So, in dealing with medically fragile individuals, which we have the pleasure of doing, it requires a little bit more coordination and care. And it can be very stressful on the parent if your child has some of these additional diagnoses, epilepsy, OCD. Um, but first question, how do you coordinate autism care with complex medical needs?
That's a great question. And I think from our perspective, when we are working as behaviorists in the home with a child on the spectrum who also has medical needs, the medical needs really need to be the priority. So often our clients have nursing staff with them, and they really are the ones that are leading the charge in terms of the day and the health activities of that day for that child. So we really work as a team, we collaborate, and we also defer to the nurse's expertise on the child's health and what needs to happen.
Absolutely. And there has to be coordination and communication. So when we walk into that home, the first thing we're going to do is check in on the physical and status of the
Absolutely.
patient in terms of how are they doing today? How did they sleep? How's it going? What's the update? And the nurses usually do give you a good update of what's next on the agenda that they need to do. Um, Yes, you also need to coordinate with the developmental pediatrician. There's a lot of coordination of medication. When would be the opportune time to give the medication, the effects of the medication?
Yeah, so it's really important to follow what is happening after that medication has been given or if there's been a medication change. Um, Medications work differently in everyone. Dosages sometimes need to be adjusted. There are side effects that can occur. So it's really important to work together to know what those possibilities are and then what we can do to mitigate any discomfort if possible. Um, you mentioned the developmental pediatrician, which I think is such a big support for these families. Not everyone can have access to a developmental pediatrician, which is unfortunate at this time. So some people may have what they call a medical home, which is like a primary care provider, nurse practitioner like myself, or a physician that sort of assists in helping the family, guiding them through an unfortunately siloed medical community, right? So you may have your nursing team, your primary care, your speech and OT, us as behaviorists. You might have a registered dietitian if there's tube feed or other feeding concerns, nutrition concerns. You might have a neurologist involved with medications. Certainly, our epileptic patients and clients would have a guidance from a neurologist, but it can be a lot. It
Yeah.
can be a lot of different appointments, different therapies, who's coming when, where do we go, how do we get there on time? And then with a medical complexity, you're also facing a likelihood of an illness and missing appointments and having to reschedule. It's so much coordination for the parent. I've had parents tell me they struggle a lot with insurance and getting enough oxygen, for example, if they need it, because you're really allotted a certain amount. But if that changes and then that order doesn't go through, or for some reason there's a miscommunication, now this parent is scrambling to get something, you know, that will keep that child alive. So I can't imagine really the daily stress that these people have to cope with. And I know that we work really hard to try to lessen that as much as possible.
Absolutely. I think it's also really ethically important to have a safety plan when you're dealing with epilepsy, and that safety plan is approved by the nurse and by the team.
And it's so important that you mentioned that because everyone needs to be on the same page. If there is an emergency that occurs, some unexpected adverse reaction to a medication or a seizure, or or maybe we're having a major digestive problem, a blocked tube. These are things that we really have to be able to act quickly to mitigate the risk for the patient and also to work as a team to take that stress level down, be calm in the moment, and be able to take the right steps.
With medically fragile individuals, you can really see where the insurance companies and the medical model is somewhat failing patients and individuals because
100%. Yeah.
they don't cover everything. And they kind of say, well, you're going to be the nurse now and
Mhm.
you're going to do all the care. But the parents can't do all the care, and I think that's what makes me so incredibly grateful still that we live in California and that we have the regional centers in California because they at times will put together the most beautiful teams of nurses round the clock
Mhm.
or respite for the child
Yeah.
so that the parent can also work and provide the money to get the insurance, to get the treatments.
Yeah. Yeah, I've had parents tell me that they feel they have to roar to get their needs met. They have to not only be the parent and the medical provider and the advocate and the person providing all of the financial structure behind what the family needs. It's incredible how much stress these families are under. And I think that there are some resources out there and there are some supports, but you're absolutely right. The regional center does provide at least a broad spectrum of services for that child's individual needs, which is wonderful.
And the medical model at times really doesn't provide the answers or the round the clock care needed for a lot of these medical fragile individuals that just need a safety plan, you know.
Mhm.
You need to review the medications. You need to know the signs of distress
Mhm.
on the case, looking for these signs constantly.